You don't like it. You wrote a piece on it. It's out today. How come?
You know, I agree with Howie that it's an issue because of what's going on in the doctor's office. It's not just the premiums being up 25%, Bill. In the doctor's office, and a new survey came out of over 1,000 physicians, 72% said their reimbursements are going down, there's too much stress. Yes, it's the individual market only, Bill, but it's affecting the whole healthcare system because if a patient comes to my office with Obamacare, Bill, I have to figure out who's taking their insurance. If I want to send them for a referral, what orthopedist is taking it? What laboratory can I possibly use? Who's going to accept their tests? I go squinting at lists, looking for doctors that I've never referred to before. It clogs up the whole system, so patients in my waiting room, waiting with employer-based insurance, can't even get to see me. Physicians are furious about Obamacare. It hasn't worked in the doctor's office. And even if Hillary Clinton doubles down on it if she were to win, and you end up with more and more subsidies, it's still a low-quality insurance that doesn't give access.
Let me put up a map here, a bit of a heat map. The darker the color on this map, the higher the increase. You see Arizona is. That's deep blue. Oklahoma. Looks like Tennessee and Minnesota as well. Take the point that Kurt's just made about some people like their insurance under Obamacare.
Well,
do they?
What they like is, and to his point, if you're a young person that you're on your parents' policy, you might want to keep that policy. But meanwhile, when you go over the age of 26, you may say, wait a minute, I only need my doctor for an insurance physical. I only need my doctor for my work physical once a year. I'd rather pay the penalty than have to have an insurance that I have to pay for all this high premium out of pocket. And guess what is going to happen if Obamacare is doubled down on? The penalty is going to be higher. And I'm not sure it's fair for somebody to be penalized for an insurance that, again, doesn't give them access to care they need.
That's the headline. Insurance is not equal quality care.
It doesn't.
That's what you found.
It doesn't. And in some of these states, premiums are going to be skyrocketing. And so across the board, it's 25%. In some states, it's as much as 60 or 70%.
Thank you, Doctor.